Friends, welcome again to our channel GK Quiz IQ and a most important video on human heart. These are very important questions for all competitive examinations. Pay attention and watch the full video till the end. Try to answer all questions within 10 seconds and comment how much you could score. Without further ado, let's start. Question number 1. How many chambers does the human heart have? The options are Option 1 2, Option 2 3, Option 3 4, Option 4 5. The correct answer is 4. The human heart has 4 chambers, 2 upper atria, left and right, and 2 lower ventricles, left and right. The atria receive blood, while the ventricles pump it out. This structure ensures efficient separation of oxygenated and deoxygenated blood. Question number 2. Which valve separates the left atrium from the left ventricle? The options are Option 1, tricuspid valve, Option 2, mitral valve, Option 3, pulmonary valve, Option 4, aortic valve. The correct answer is mitral valve. The mitral valve, also called the bicuspid valve, prevents backflow of blood from the left ventricle to the left atrium during ventricular contraction. It has 2 flaps. Unlike the tricuspid valve, 3 flaps on the right side. Question number 3. What is the average resting heart rate for a healthy adult? The options are Option 1, 30 to 50 beats per minute, Option 2, 60 to 100 beats per minute, Option 3, 110 to 140 beats per minute, Option 4, 150 to 180 beats per minute. The correct answer is 60 to 100 beats per minute. A normal resting heart rate ranges between 60 to 100 bpm. Athletes may have lower rates, 40 to 60 bpm, due to higher cardiovascular efficiency. Question number 4. Which arteries supply blood to the heart muscle itself? The options are Option 1, pulmonary arteries, Option 2, coronary arteries, Option 3, carotid arteries, Option 4, aortic arteries. The correct answer is coronary arteries. The coronary arteries branch of the aorta and deliver oxygen-rich blood to the myocardium. Blockages here cause angina or heart attacks. Question number 5. Who discovered the circulation of blood in 1628? The options are Option 1, Alexander Fleming, Option 2, William Harvey, Option 3, Louis Pasteur, Option 4, Andreas Vesalius. The correct answer is William Harvey. Harvey's work De Motu Cordis detailed how blood circulates through the heart and body, overturning earlier theories like Galen's blood consumption model. Question number 6. What is the medical term for a heart attack? The options are Option 1, myocardial infarction, Option 2, ischemic stroke, Option 3, arrhythmia, Option 4, hypertension. The correct answer is myocardial infarction. A myocardial infarction occurs when blood flow to a part of the heart is blocked, causing cardiac muscle cell death. Prompt treatment with clot-busting drugs or angioplasty is critical. Question number 7. Which part of the heart generates its electrical impulses? The options are Option 1, bundle of his, Option 2, Purkinje fibers, Option 3, sinoatrial SA node, Option 4, atrioventricular AV node. The correct answer is sinoatrial SA node. The SA node, located in the right atrium, acts as the natural pacemaker by initiating electrical signals that trigger heart contractions. Question number 8. What condition is characterized by irregular heartbeats? The options are Option 1, atherosclerosis, Option 2, arrhythmia, Option 3, tachycardia, Option 4, bradycardia. The correct answer is arrhythmia. Arrhythmias include atrial fibrillation, rapid, irregular beats, and ventricular fibrillation, life-threatening. Treatments include medications, cardioversion, or implantable devices like pacemakers. Question number 9. Which is the largest artery in the human body? The options are: Option 1, pulmonary artery. Option 2, aorta. Option 3, coronary artery. Option 4, femoral artery. The correct answer is aorta. The aorta carries oxygenated blood from the left ventricle to the body. It is about 2 centimeters in diameter and withstands high pressure due to its elastic walls. Question number 10. When was the first successful human heart transplant performed? The options are: Option 1, 1953. Option 2, 1967. Option 3, 1982. Option 4, 1990. The correct answer is 1967. Dr. Christian Barnard performed the first transplant on Louis Washkansky in Cape Town, South Africa, on 3rd December 1967. The patient survived 18 days. If you find this video informative, then please subscribe, like, comment, and share. Question number 11. What is the function of the pericardium? The options are: Option 1, pump blood. Option 2, filter impurities. Option 3, protect and lubricate the heart. Option 4, produce red blood cells. The correct answer is protect and lubricate the heart. The pericardium is a double-layered sac enclosing the heart. Its fluid reduces friction during heartbeats. Pericarditis, inflammation of this layer, causes chest pain. Question number 12. Which chamber of the heart has the thickest muscular wall? The options are: Option 1, right atrium. Option 2, left atrium. Option 3, right ventricle. Option 4, left ventricle. The correct answer is left ventricle. The left ventricle pumps blood to the entire body, requiring stronger contractions. Its wall is about 1.3 centimeter thick, compared to 0.5 centimeter for the right ventricle. Question number 13. What does an electrocardiogram, ECG, measure? The options are: Option 1, blood pressure. Option 2, electrical activity of the heart. Option 3, cholesterol levels. Option 4, oxygen saturation. The correct answer is electrical activity of the heart. An ECG records the heart's electrical signals, helping diagnose arrhythmias, heart attacks, and other conditions. The P wave, QRS complex, and T wave represent different phases. Question number 14. What is the leading causes of death globally? The options are: Option 1, cancer. Option 2, respiratory diseases. Option 3, cardiovascular diseases. Option 4, diabetes. The correct answer is cardiovascular diseases. As per WHO, cardiovascular diseases cause 17.9 million deaths a year. Risk factors include smoking, poor diet, and hypertension. Question number 15. Which vitamin deficiency is linked to heart disease? The options are: Option 1, vitamin A. Option 2, vitamin B12. Option 3, vitamin C. Option 4, vitamin D. The correct answer is vitamin D. Low vitamin D levels correlate with hypertension and inflammation. However, causation is debated. Supplements are not universally recommended for heart health. Question number 16. What is cardiac output? The options are: Option 1, heart rate multiplied by stroke volume. Option 2, blood pressure multiplied by heart rate. Option 3, oxygen consumption multiplied by heart rate. Option 4, stroke volume multiplied by blood volume. The correct answer is heart rate multiplied by stroke volume. Question number 17. Which condition is caused by narrowed coronary arteries? The options are: Option 1, angina pectoris. Option 2, pericarditis. Option 3, endocarditis. Option 4, cardiomyopathy. The correct answer is angina pectoris. Angina causes chest pain due to reduced blood flow to the heart. Stable angina occurs predictably, while unstable angina is a medical emergency. Question number 18. What device is implanted to regulate heart rhythm? The options are: Option 1, stent. Option 2, pacemaker. Option 3, defibrillator. Option 4, ventricular assist device. The correct answer is pacemaker. Pacemakers send electrical impulses to maintain a normal heartbeat. Modern devices can adjust rates based on physical activity. Question number 19. Which congenital heart defect involves a hole in the septum? The options are: Option 1, tetralogy of Fallot. Option 2, atrial septal defect. Option 3, coarctation of the aorta. Option 4, patent ductus arteriosus. The correct answer is atrial septal defect. ASD allows oxygenated and deoxygenated blood to mix. Small defects may close naturally. Larger ones require surgery or catheter-based repair. Question number 20. What is hypertension? The options are: Option 1, low blood pressure. Option 2, high blood pressure. Option 3, rapid heart rate. Option 4, slow heart rate. The correct answer is high blood pressure. Hypertension damages arteries over time. Lifestyle changes, diet, exercise, and medications help manage it. Friends, please like, comment, and subscribe. Question number 21. Which drug is commonly used to prevent blood clots? The options are: Option 1, statins. Option 2, aspirin. Option 3, beta blockers. Option 4, nitroglycerin. The correct answer is aspirin. Aspirin inhibits platelet aggregation, reducing clot risk. It's used in low doses, 81 mg, for heart attack prevention. Question number 22. What is the term for hardening of the arteries? The options are: Option 1, atherosclerosis. Option 2, arteriosclerosis. Option 3, myocarditis. Option 4, ischemia. The correct answer is arteriosclerosis. Arteriosclerosis refers to arterial thickening stiffening. Atherosclerosis, A subtype, involves plaque buildup. Both impair blood flow. Question number 23. Which heart layer contains muscle tissue? The options are: Option 1, epicardium. Option 2, myocardium. Option 3, endocardium. Option 4, pericardium. The correct answer is myocardium. The myocardium is the middle layer responsible for contractions. Damage here, example, from infarction, weakens pumping ability. Question number 24. What is the primary function of the right ventricle? The options are: Option 1, pump blood to the lungs. Option 2, pump blood to the body. Option 3, receive blood from the lungs. Option 4, filter blood. The correct answer is pump blood to the lungs. The right ventricle sends deoxygenated blood to the lungs via the pulmonary artery. It operates under lower pressure than the left ventricle. Question number 25. Which test uses sound waves to create heart images? The options are: Option 1, ECG. Option 2, echocardiogram. Option 3, MRI. Option 4, angiogram. The correct answer is echocardiogram. Echocardiography uses ultrasound to assess heart structure and function, including valve abnormalities and ejection fraction. Question number 26. What is blue baby syndrome caused by? The options are: Option 1, high cholesterol. Option 2, tetralogy of Fallot. Option 3, rheumatic fever. Option 4, hypertension. The correct answer is tetralogy of Fallot. This congenital defect includes 4 abnormalities, causing cyanosis, blue skin, due to oxygen-poor blood circulation. Surgical correction is essential. Question number 27. Which mineral is critical for heart muscle contraction? The options are: Option 1, iron. Option 2, calcium. Option 3, sodium. Option 4, potassium. The correct answer is calcium. Calcium ions enable the sliding filament mechanism in muscle cells. Imbalances, hypercalcemia, disrupt heart rhythm. Question number 28. What is sudden cardiac arrest often caused by? The options are: Option 1, ventricular fibrillation. Option 2, asthma attack. Option 3, stroke. Option 4, diabetes. The correct answer is ventricular fibrillation. VF is a chaotic rhythm where the heart quivers instead of pumping. Immediate CPR and defibrillation are vital for survival. Question number 29. Which vitamin is synthesized by the heart? The options are: Option 1, vitamin K. Option 2, vitamin B12. Option 3, vitamin D. Option 4, none. The heart does not synthesize vitamins. The correct answer is none. The heart does not synthesize vitamins. The heart's primary role is pumping blood. It does not produce vitamins. Vitamin D is synthesized by the skin via sunlight. Question number 30. What does CABG stand for in heart surgery? The options are: Option 1, coronary artery bypass graft. Option 2, cardiac artery blood gas. Option 3, coronary angiogram blood group. Option 4, cardiovascular arterial bypass graft. The correct answer is coronary artery bypass graft. CABG reroutes blood around blocked coronary arteries using grafts from other vessels. It's common for severe coronary artery disease. Not subscribed yet? Please subscribe to support us. Question number 31. Which hormone increases heart rate during stress? The options are: Option 1, insulin. Option 2, adrenaline. Option 3, estrogen. Option 4, thyroxine. The correct answer is adrenaline. Adrenaline, epinephrine, is released by adrenal glands during the fight-or-flight response, boosting heart rate and blood flow to muscles. Question number 32. What is the average weight of a human heart? The options are: Option 1, 150 to 200 grams. Option 2, 250 to 350 grams. Option 3, 400 to 500 grams. Option 4, 50 to 100 grams. The correct answer is 250 to 350 grams. An adult heart weighs 250 to 350 grams in men and 200 to 280 grams in women. An enlarged heart, cardiomegaly, can exceed 500 grams. Question number 33. Which condition is linked to rheumatic fever? The options are: Option 1, rheumatic heart disease. Option 2, atherosclerosis. Option 3, hypertension. Option 4, myocardial infarction. The correct answer is rheumatic heart disease. Untreated strep throat can lead to rheumatic fever, damaging heart valves, especially the mitral valve. Antibiotics prevent recurrence. Question number 34. What is the Frank-Starling law related to? The options are: Option 1, blood clotting. Option 2, heart contraction strength. Option 3, nerve impulse transmission. Option 4, hormone regulation. The correct answer is heart contraction strength. The Frank-Starling law states that the heart's stroke volume increases with greater preload, blood filling the ventricles, optimizing output. Question number 35. Which imaging technique uses X-rays for heart vessels? The options are: Option 1, angiogram. Option 2, echocardiogram. Option 3, MRI. Option 4, CT scan. The correct answer is angiogram. Coronary angiography injects contrast dye into arteries, highlighting blockages on X-rays. It guides stent placement or bypass decisions. Question number 36. What is the function of the chordae tendineae? The options are: Option 1, generate electrical impulses. Option 2, prevent valve prolapse. Option 3, pump blood. Option 4, filter blood. The correct answer is prevent valve prolapse. These tendon-like cords anchor the AV valves, mitral tricuspid, to papillary muscles, preventing inversion during ventricular contraction. Question number 37. Which enzyme is a blood marker for heart attacks? The options are Option 1, amylase. Option 2, troponin. Option 3, lipase. Option 4, pepsin. The correct answer is troponin. Troponin proteins leak into blood when heart muscle is damaged. Elevated levels confirm myocardial infarction within hours. Question number 38. What is the term for inflammation of the heart's inner lining? The options are Option 1, pericarditis. Option 2, myocarditis. Option 3, endocarditis. Option 4, atherosclerosis. The correct answer is endocarditis. Endocarditis often results from bacterial infection. Example, Staphylococcus. It damages valves and requires prolonged antibiotic treatment or surgery. Question number 39. What percentage of blood is pumped by the left ventricle to the body? The options are Option 1, 25%. Option 2, 50%. Option 3, 75%. Option 4, 100%. The correct answer is 100%. The left ventricle pumps all systemic blood. The right ventricle pumps the same volume, but to the lungs at lower pressure. Question number 40. Which animal was used in the first artificial heart experiments? The options are Option 1, dog. Option 2, pig. Option 3, cow. Option 4, rabbit. The correct answer is dog. In the 1950s, dogs were used to test early artificial hearts. The first human-implanted Jarvik 7 was in 1982. Barney Clark survived 112 days. This is the end of this video. Thank you for watching. If you like this informative video, please subscribe, like, comment, and share.